Brian, do you feel that the physician champion, if you will, that should start a peer support program, do they need to be on that level of chief of staff, chairman of the department, or can any physician who has this as a passion take this on for their organization?
I don't think that it needs to be someone in an official capacity like that. I think it helps. They're there where they can get some resources, they can get some attention from folks in the organization. What I do think is it needs to be someone, like Joe said, for a peer supporter. It needs to be someone who is a respected clinician in the organization. It can't be someone will say, well, yeah, sure, Joe would say that. She's not very good at this and she needs a lot of support. It has to be someone who you'd say, wow, if Joe says that, then it must be meaningful. It must mean something to her, and I respect her as a clinician. So usually a senior, well-respected doctor, it seems to me, is the best source of sort of the energy to get this moving.
Mm-hmm. Joe, do you have any comments about that?
Yeah, I think so. I think I agree completely with Brian. I guess I would look at it as you need a champion, someone who's really passionate about doing the work and who is interested in organizational work, but has some standing in the community.
Mm-hmm. And Brian, you highlighted one of the reasons you became interested in peer support program was because of your own personal journey. Joe, it didn't seem like you had the same personal impetus with an event that happened, so it sounds like you could start a peer support program where that physician champion can be someone who takes it on as the right thing to do, not necessarily as an impact from something that happened to them. Do you have any comment about that?
Well, I think it's fair to say that I absolutely, underneath this was the reason I was interested in peer support in particular, as one of the things that our Center for Professionalism and Peer Support does is because of my experience and the experience of my colleagues. You know, again, being a surgeon, but being any clinician, I mean, I've made errors, and I recalled also, my goodness, it really felt traumatic, and I had a lot of support, and familial support. I'm married to a physician, and my sister and brother-in-law are practicing clinical psychologists, so they give me therapy, and my mom, and we all get together, but regularly and support each other. But I thought, wow, there was nothing sort of in the professional realm around that, and I also noted, wow, I'm in the mid-career, same as Brian was, and I've done a lot of, in particular, this was a complication from an operation that I do a lot of, and I had done a lot of, and I thought, I feel this bad. What if I had just started practicing? Would it be even worse? And then also talking to colleagues and noticing how stressed they felt after things went wrong. So that was part of, underlying my impetus to be involved in the peer support in particular. I think my motivation to start a program really came from my work. I had been an associate director for graduate medical education for Partners, Brigham and Women's and Mass General and the affiliates. And just in that role, working with so many faculty and leaders and students and, of course, residents and fellows, just seeing the angst around the pressures of practice that and not just errors, so many other things that we are dealing with and that are part of our job, and rightfully so. So I felt motivated on an institutional level to say, we need to really have programs that work upstream so that the people doing the clinical work, the education, the research are, in a sense, much better able then to do that work and to be there for patients or their students, et cetera.